for organizing this session for us, and of course all my dear colleagues and faculties who are here. Now we try and keep this focus workshop twice a year, and we try to maintain a batch of only 20 or 25. Okay, you might wonder why the registrations are not beyond 25. The reason is we want to have maybe 6 candidates on one table. That's what our overall intention is, so that you have a good hands-on experience. And we being a reasonably busy hospital with emergency department as well as ICU, we will see a lot of trainees are coming from our own hospital itself who want to have a formal way of understanding, whether it's emergency, whether it's ICU, some of them could be from medicine and other departments as well. So the whole understanding of point of care ultrasound as a course is to make you, sensitize you, teach you to utilize this skill as a stethoscope for the 21st century. Okay, so if you look at the 21st century, literally now nobody just listens at the heart sound and says this is a grade 1 by 4 murmur, grade 3 by 4 murmur. We all want an ultrasound of the heart to understand how severe is the murmur, what is the murmur coming from, which valve is it involved, how bad is the stenosis, how bad is the regurg, so on and so forth. A lot more information flows into it. Similarly, lung ultrasound has been a cornerstone now for hemodynamic assessment as well as understanding a lot of lung dynamics. And this has been started in the last 15 years or so, and now it's become a standard of care. And of course, your abdominal ultrasound, where you are able to specifically look for some collections, some organs, how they are looking at. You can pick up abnormalities, and then of course you come to a point of doing procedures which are ultrasound guided. Now there is no doubt about it that in this time and age where you are learning procedures, it is a crime not to use an ultrasound. And I am not using this word just for the sake of it. There have been number of cases in the last 5 years which have gone in the favor of petitioners who have petitioned against doctors because they did not use ultrasound to actually do a procedure. And that procedure could be a simple central line, it could be a ascitic tap, it could be a pleural tap, it could be anything else which requires a little bit of guidance before you poke a needle or you poke a tube in there. Okay, so I think it's mandatory for you now to learn how to use an ultrasound, especially if you are a acute care physician who is going to do these procedures on a regular basis. An acute care physician includes ICU, ER, anesthetist, normal physicians as well who would be doing lumbar punctures and ascitic tapping into the ward, or chest physicians who are doing pleural tapping into the wards on a regular basis. So utilize this. Motto should be to get yourself sensitized and acquire the knowledge, and follow up is the most important thing. If you don't come back to ICU or ER and don't start using the probe regularly on day-to-day basis, one, image acquisition will become a problem. You will not be able to get good proper images, and two, you will not be able to understand what is normal before you can interpret what is abnormal. And the learning curve is not huge. You can probably have a reasonable proficiency if you continue to use it on a day-to-day basis in your clinical practice over a year or two. You go through phases. You go through a learning phase, then you go through a phase where everything seems abnormal, then you go through a phase where everything seems normal. Then when you sort of are 2 or 3 years down the track, you start recognizing and have a balanced view about what is normal and what is abnormal. So it takes around 2-3 years for you to become proficient, which would be a time of your training, 3 years of MD, 3 years of ICU training, 3 years of ER training, whatever it is. Okay, so utilize these courses, and as I said, we do it twice a year. Our students are more than welcome to join anytime they want, and let's see, we are exploring the possibility of having it more than twice a year as well going forward. But for this year, at least it's going to be twice a year only. Next year, 2025, we will see how things move. Thank you very much. Back to you, Vikrant.